has a very new legislation. We have a transitory time period, and that is every time is a little bit complicated in consideration that the requirement change a lot. In the specific case of a medical device and in vitro diagnostic medical device, the new regulation impose new requirements that are really challenging for the industry and also for the regulators. So in this case, the transition is not so easy. Moreover, the transition was expected during the COVID period, and this was one of the reasons why it was delayed the time when the regulation was enforced. But in any case, there was so many things to do in that period, and this was not easy, and it is not easy to reach the final goal. Even the notified body needs new competence, new people that work on that. And also in this sense, there are some problems that are more or less now in resolution, but in any case that pone some delay in the obtaining the new marketing. I think that the European Commission, with what we call NANDO system, did and is doing a very good work on that. So now we have many notified body in different countries, and I think that now we can say that they are enough. Of course, if we have more, that is better. But in any case, I don't think that this is really now the problem. There are still some problems because, as I tried to tell before, we need a new competence by the notifying body. So every notified body needs to form people, assessor and an inspector, and of course that needs time and need experience. Need discussion among the different notified body that is, of course, is ongoing, but there are still in some situations something that is not really very clear, and this pose a problem and delayed the time of obtaining the marketing. We know that the industry of medical device is completely different from industry for example, medicinal product. We have a lot of small or medium enterprises, especially in Italy. For example, we have in Emilia-Romagna many of these industries that produce and that make research and produce very innovative medical device. But the majority of them are small industries. And of course, when you change so much the situation and change the requirement and change the regulation, the small industry have more difficulties in answer to that. And this, of course, can be a problem and is a problem. But also in this case, I am sure that people working in this field are really people that are involved in innovation, very fast innovation. There are people with different kind of competence like engineering, pharmaceuticals, microbiologists, and so on. So I am confident that even if for small industries is much more difficult, of course, they can go through this bridge without a big problem. I would like to start with software. That probably is easier. because with substance the situation is a little bit complicated. As far as software, of course can be considered medical device if the aim is related to diagnostic, treatment or prevention of pathologies. Of course, we have a lot of software that are near, borderline, because they, for example, they can be used for improved health, but in a general way. And in this case, of course, they are not really medical device. So we have borderline with free product without any specific regulation. But we have no problem anymore in considering what we call digital therapeutics. Digital therapeutics are software, sometimes are gaming, that can be used by the patients directly, with the computer, with the phone, to improve, to treat their pathologies. And for this product, at the beginning, there was a little bit of discussion if they has to be considered medicinal product or medical device. But now I think that everywhere, all around the world, we agree that they has to be considered medical device and not medicinal product, because they don't have a pharmacological effect. In any case, they are a very particular medical device, so probably we need some special rules on them. I don't think that the problem is really the mark to obtain the mark, but to go on the market. That means, for example, how to determine the price, how to determine the setting where to be used, and so on. On this part, for this situation, we have different solutions in different countries, because we have to remember that we are the regulation, the European regulation, take care of how to go to the market. So which kind of study we need to demonstrate the efficacy and safety and quality of the product. But when the product is on the market, what happens after that in the commercialization, in the market access, that can be very different from country by countries. And in this sense, for example, for digital therapeutics, we know that, for example, in Germany and French, we have a lot of them on the market and are reimbursed. In other countries like Italy, we are still a little bit behind this. Now we have some of them on the market, but still with some difficulties. As far as the substance, this is really still a big problem. Of course, the borderline with medicinal product or the borderline with cosmetics, sometimes it's very difficult to determine if the product have to be classified in one category or in the other. For example, we have cream that we can put on the skin, that if they protect the skin with a mechanical properties, they can be considered a medical device. And for example, we have also a syrup that is considered a medical device because the mechanism of action is related to the protection of the mucosa. For these products, I understood that we have different ideas in the different countries. In Italy, we have a lot of this product, and in the last decades, our Ministry of Health worked a lot with our industry to discuss this and to determine which one are really medical device. And we have on the market a lot of this medical device made by substance. In other countries, the situation is a little bit different. So we have a lot of discussion country by country, because here the problem is not of market access, but of obtaining the mark. And in this sense, in consideration that if you obtain the mark in one country with a notified body that is in one country, that mark is is valuable everywhere, everywhere in all the other member states, this poses some problem. And of course, if two countries didn't agree, there is a committee at European level that can discuss this. And there is a guideline on that. And so we have some resolution for some product, and other products are still on discussion. And probably in the next year, I think that we will see what happened. And it could be that we have to decrease in the number of medical product based on substance, even if I hope that the Italian view can become much more considered also in other countries, even if some countries, I don't want to say the same, but Germany is one of these, consider them as a medicinal product more than medical device. And sometimes also the discussion on the mechanism of action is not so easy. The mechanism of action is new, but it's difficult to make differentiation between it is really a mechanical action, there is an impact on the cell, human cell or not, it is not so easy. When there are problems on the science part and the science field, of course, the regulation is difficult. If everything is clear from the scientific point of view, also for the regulator, everything is easier. And for substance, is not always so clear, and so sometimes it's difficult.